I want to start by telling you all a story. The stories of my friend Santiago. He's 52 years old. He's a shift worker at the Staples Center in Los Angeles, California. His 18-hour workdays are interrupted by frequent trips to fast food restaurants because that is all he can afford to eat. And his doctor tells him that his diabetes and his hypertension are so severely uncontrolled that they will prevent him from doing the one thing that he wants more than anything in this world: to dance at his granddaughter's wedding. Santiago, his doctor, which is the only person who he talks about his healthcare with, spends about 1.3 minutes on average with Santiago. And studies show that only 20% of what his doctor says will actually be remembered and retained by Santiago when he goes home. And it is very likely that he does not know how to do simple things like take his medication, or understand how to inject insulin properly, or keep it cold, or avoid the types of foods that can exacerbate his condition. Santiago's story is part of a phenomenon of the biggest healthcare crisis that we have seen in the last century. And we all know the statistics about the prevalence of chronic preventable diseases, but what you don't hear often enough is the fact that individuals that are below the poverty line, individuals like Santiago, are disproportionately affected by these conditions. And I think you should care about this because that ends up costing the healthcare system 2 to 3 times more than the rest of the population. So you may be thinking, like, why am I standing here talking about this problem? Well, I actually suffered from childhood obesity. I was 100 pounds overweight than what I am right now. And through the process of losing that weight and overcoming prediabetes, I became enamored with the idea of personal transformations. And I took a leave of absence from school to work in one of the poorest cities in America, Galveston, Texas. And as one of the 3 full-time people working in a city of 50,000 uninsured patients, I realized what was wrong with our healthcare system, that we just weren't paying enough attention to actually solving the root cause of the problem, and we were focusing too much time on the symptoms. And so I started a mobile health organization to leverage the fact that low-income patients and individuals with resources have one and only one equalizing factor, which is their mobile phone. In fact, individuals below the poverty line use text messaging technology twice as much as individuals that are above it. And so building a technology platform that can empower healthcare organizations with the tools they need to improve appointment attendance, to improve medication compliance, glucose monitoring, blood pressure monitoring, and create health coaching programs that can empower their patients to take better control of their health became our mission. And over the last year, we partnered with healthcare organizations in San Francisco and Los Angeles that were working with the poorest of the poor, the hardest to reach populations, helping them improve their outcomes from diabetes to hypertension, to high cholesterol, to asthma, to childhood obesity, helping solve the healthcare crisis in the United States. And I want to announce today that we want to actually bring this technology and empower healthcare organizations in the city of Chicago, which has one of the highest rates of diabetes in the entire country. So I want to end by talking a little bit about responsibility and personal responsibility. And one of the things that we have often talked about at the Tech Summit, and a lot of amazing people that have come before me, that will come after me, are going to be talking about the value of technology and the immense power of just stretching the boundaries of innovation. And I think that's fantastic. But what I also think that we have a duty to do is leverage a technology that's already available and already existing to improve the lives of millions of people who would never have access to it for something that's as critical as their health. I know that there's at least one clinic in Galveston and at least one amazing guy in Los Angeles that will benefit from our efforts. Thank you.